Hi everyone, it's Dr. Danielle Cooper, Dallas plastic surgeon at Fresh Image Cosmetic Surgery Center. Today I'm going to discuss labiaplasty. So what is a labiaplasty? Well, women that have excess tissue down below might want to have that tissue reduced, and that's essentially what a labiaplasty does. It typically addresses the inner lips or the labia minora. Now there are the outer lips as well called the labia majora. You can address those as well if that's something that bothers you, but typically when we discuss labiaplasty, we're referring to the inner lips or the labia minora. So women that have extra tissue of their labia minora can go through a labiaplasty procedure to have that reduced. Typically women might want this because the excess tissue is just uncomfortable, particularly when they're wearing certain clothing or doing certain activities like riding a bike. And so reducing that tissue can help them feel more comfortable. And so there are two different ways that you can do a labiaplasty. One is called the trim labiaplasty, where essentially you just cut the outer edge of the labia to make them smaller. And then there's the wedge resection labiaplasty, where you essentially take out a triangular shaped piece of tissue to really reduce the size of the labia in that way. And there's different reasons why you might choose one procedure over the other, and typically that's left up to your anatomy and to your surgeon and also patient preference. I tend to prefer the wedge resection labiaplasty because it allows you to maintain the normal scalloped edge of the labia, so it gives a more natural appearance in my opinion to do it that way. And it also allows you to address any extra length that you have in the labia minora as well. So that tends to be my go-to procedure if a patient comes to me with a desire of a labiaplasty. Now, as far as the post-operative care, important things to take into consideration is you will be very swollen after the procedure for a few days, so icing is going to be very important. And usually we're using absorbable sutures or dissolvable sutures, which means that you don't have sutures that have to be cut out later on. But because of that, those sutures aren't as strong as a permanent suture that would need to be cut out. So you have to be very careful with cleaning the wound down there and making sure that you're patting dry instead of wiping so that you don't break those sutures and cause the wound to open up. Now, an important thing to keep in mind is after this procedure, we're not going to want you to have any sexual activity or even tampon use for several weeks, because again, we don't want any tugging or pulling in that area that can cause the wounds to open up. So that's something that you want to plan ahead for if that's something that you're interested in doing. So if you have any other questions about labiaplasty, leave them in the comments below. I'm happy to answer any questions that you might have.